So, one thing is addiction disorders are specifically barred as qualifying conditions for federal disability programs, SSDI and SSI. So, and people with addiction disorders have a lot of co-occurring physical and mental health challenges that require proper medical care. And so people with addictions are basically low income adults without dependents or qualifying disabilities very often. And they are covered in large part under the ACA Medicaid expansion. And they're also a population, by the way, that is distinctively vulnerable to the administrative burdens that you just heard about. And the Medicaid expansion has made possible an entire infrastructure of care for people with addictions. For example, people leaving jails and prisons around the country who require addiction treatment and related supports. So in our own work, we actually found that jails and colleagues' other work, that jails and problem-solving courts like drug courts are much more likely to offer medication treatment for opioid use disorders if they're in a Medicaid expansion state. And the reason is that these jails and problem-solving courts are small players in a local ecosystem of addiction care, and they rely on that whole ecosystem that Medicaid, ACA Medicaid expansion has made possible. So in my own work serving people leaving jails and prisons here in Illinois, more than two-thirds of our study subjects are Medicaid recipients. Many are older men with serious health challenges. I should say 11 of our study subjects have died, and others likely would have died if they didn't have access to medical care. Okay. So these realities are very well understood around the country, and they provide one reason why, ironically, the ACA Medicaid expansion proved to be the unexpected bipartisan jewel of the Affordable Care Act. Republican governors, including John Kasich, Jan Brewer, and Doug Ducey, proved critical in preventing the ACA repeal. You see over on the right, Governor Kasich credited Medicaid expansion for helping Ohio deal with the overdose epidemic. And under there's Jan Brewer signing Medicaid expansion legislation. One of the striking things in the Senate debates over the ACA is that every Republican member of the Senate Finance Committee, they have all voted against the ACA in the end, but they all voted for all the behavioral health components of the ACA because they understood this was needed. And a lot of us were worried when the ACA was passed that we would see a sort of Willie Horton-like politics emerge. There would be some person who left a jail or prison who picked up Medicaid under the ACA and then stabbed a nurse or something like that and became Willie Horton. What's striking is that Republicans around the country really did not go in that direction, and that is really something to be noted. Okay, so now for those reasons, for everything I've just talked about, the proposed Medicaid cuts are really going to cause thousands of avoidable deaths annually in the United States. Angela Wise and Bruce Meyer had estimated that Medicaid expansion saved 27,400 lives, and an additional 12,800 deaths could have been prevented had all states opted to expand Medicaid. The population of people with addiction disorders are a good chunk of that 27,400 and that 12,800 that I'm talking about. And we just saw there's some new research that argues that that estimates that the Senate reconciliation bill, if it's passed, would result in 51,000 avoidable deaths annually, including 11,300 deaths from the loss of Medicaid or market-based coverage. So let's not do this. I'm gonna stop here so that we have time for discussion.